The Karnataka Health Department issued a COVID-19 advisory on Tuesday after a case of JN1 subvariant was found in Kerala. The advisory has been issued based on recommendations made by the Karnataka COVID-19 Technical Advisory Committee as the COVID cases are rising in neighboring states and due to the festive season ahead. Senior citizens, people with comorbidities, and others are advised to wear masks. People with respiratory symptoms are asked to seek medical consultation, and the citizens have been asked to maintain hygiene practices. The Karnataka Health Department said it has also taken up a few proactive measures in the light of caution from the centre and the TAC. State Health Minister Dinesh Gundu Rao stated that more testing will be done in the state and there is no need to panic as major cases have not yet been reported from Karnataka.
Technical Advisory Committee, they conducted a meeting and they've given us suggestions, and as per this suggestion, the advisory is, I think maybe shortly issued, already issued. It's in, right now it can be issued any minute.
It is issued.
Issued, yeah. So basically, we'll be advising our people, especially older people, people above 60, to be careful and to wear masks. Preferably, they should wear masks because they should avoid getting infected. And also people who have got comorbidities, who have got low immunity and have got kidney, heart, or any other such problems, they should also be careful and wear masks. And people who are carrying respiratory infections or got fever and cold and sore throat and all these kind of infections, they also should voluntarily they should wear masks so that they don't infect others. And all these people who are infected, they should get tested for COVID. So that is the basic thing of the advisory that we'll be issuing. And rest is mainly about our own preparedness. We'll be doing that. Already we've been doing that and getting our hospitals and all our health centers to be prepared for any eventuality. Hopefully, nothing is going to happen. I feel people should not get worried or people should not get worked up. So far, there's been no incidents of COVID directly, COVID-related death, and even JN1, Singapore and other countries, also in Kerala, they've seen I think one or two incidents of JN1. So far, there's no fatalities coming out from that also. So I would say that let us just keep vigil and keep ourselves prepared, but not don't get worked up or worried. That is my only
Will you
suggestion.
increase any kind of testings as well as
Testing is
the
very
vaccination?
testing is very important for us because we need to start testing in higher numbers. So we are procuring already we've indented for more RT-PCR kits and RT. What we have now is insufficient. So we have to maximize testing in all our hospitals, even private hospitals, so that we know what is the extent of the spread of COVID. More and more people getting infected. So then we can work out what we need to do further. So that is something that is a priority for us right now. Right now, no restrictions on movement, on gathering, or having events. No restrictions, absolutely. And I feel that people should not get worked up on this issue. We are keeping vigil and we will keep track. And tomorrow we also have a meeting with Union Health Minister and all the state ministers. So whatever further things that we need to do, we will take stock of the situation. But I feel that let us be prepared, but let us not get too worried about it or get panicky about this. See, Kerala is, I mean, of course, it's our border state. So whatever happens in Kerala can affect Karnataka also. So we'll be extra vigilant in the border areas. But at the same time, no restriction of movement, interstate movement also. So number of cases have so far not increased too much. But we will keep track by increasing the number of testing. So once we start testing more, then we can give you a better picture on this. But so far, no serious COVID-related incidents has happened in Karnataka where people, because of COVID, have come to the hospital and have got into ICU and are facing
One case has been detected in Mandia, sir.
Yeah, but that is we still don't know whether it's JN1 or not. That is, I don't think it's been identified as such. So we will keep track and we'll be prepared. But hopefully it should not get so serious.
Okay, this particular variant is a subvariant of Omicron. It is no different from Omicron. The similarities in the presentation is almost 90% the same. Basically, what happens in this particular variant is there is a particular mutation which is happening in the spikes. I'm sure everyone remembers the COVID virus. That's the structure of the virus with spikes like a cartwheel.
Yeah.
So there is one single mutation in the cartwheel on the spike that basically has a capacity to adhere to the lung tissue of the human being wherever it gets attached. So that adherence is what basically will impact the spread.
Okay.
So when we're talking about JN, the mutation of Omicron, we are going to have might have an extensive spread of the same variant because of the particular thing which I told you. The attachment on the spike is more prone to Omicron on this particular variant, and because of that, kind of I would say the attraction and the attachment to the human lung, the spread can be extensive.
Okay.
And that's about things, but it's a mutated variant. So actually, just keep in mind that any virus, for that matter, after mutation is not as strong as it was
Oh, in the initial
in the
phases.
initial stages.
Yeah.
Okay, so we had Delta.
Hmm.
I'm sure we had Delta, which is really a catastrophe and a humanitarian disaster. So after Delta, the next wave was a slower one or lesser, thing. But when the second wave spiked up, the second mutation was still stronger, still the same as Delta.
Yeah.
But when Omicron came up, it mellowed down. Because already when Omicron started up, the mutations were extensive. Mutations is something that the virus keeps changing its stature, its kind of its behavior, its assembly. It kind of goes on mutating and changing. So what we have now is after multiple mutations of Omicron.
Okay.
So I presume it will not be strong. It will be weak, but it can spread more.